There's a big misunderstanding when talking about hospice care versus palliative care, because a lot of times patients are enrolled in hospice care and palliative care around the same time of their prognosis towards their later stages of life. But that doesn't always have to be the case when it comes to palliative care. And let me explain. So let's define what both of these are. Hospice care is the more understood term where you essentially have a patient that has a terminal condition where they're expected to live less than 6 months. They will qualify for hospice care, and essentially at that point, all curative treatments are stopped and they're essentially on hospice care to have comfort for their final stage of life. A lot of times palliative care is brought in at the same time of hospice care, but it doesn't have to be. The beauty about palliative care is that anybody, regardless of their age, if they have a chronic condition, they can qualify for palliative care, and that's huge. You could have somebody in literally their 30s, 40s, or 50s that has some sort of chronic condition, chronic kidney disease, maybe a neurological disorder, where they need relief and help with symptom management. They can qualify for palliative care to address the symptoms related to that chronic condition, and they can still be on curative treatment like therapies, and they can be on palliative care for the long term. So in the normal situation and the way that the healthcare system works today, a lot of times hospice and palliative care are a little bit misunderstood how they interact. A lot of times they're kind of bundled together, but always remember, if you have somebody in your life that has a chronic condition, they can benefit from palliative care at any age. It can drastically help improve that symptom management. They can go through curative treatment elsewhere outside of that chronic condition, and it can really increase their quality of life.